Well, we are having an early and aggressive pollen season here in the Palmetto State, and the symptoms can be confused with those of the coronavirus. Our Samantha McCullum talks to an expert to help you know the difference.
This year's pollen season is in full force.
We've been warm, unseasonably warm early this year, and so we've had a lot more pollen.
Dr. Robert Puchalski is with South Carolina Ear, Nose, and Throat. Here's what he says most of us encounter.
Common allergy symptoms are generally seasonal, and they're usually limited hay fever symptoms to the eyes and nose predominantly. So itchy eyes, itchy nose, runny nose, frequent sneezing, nasal congestion are the hallmark symptoms of hay fever. So not full body symptoms.
So what about the coronavirus?
So the nasal symptoms in particular would overlap significantly between coronavirus, the flu, and allergies.
COVID-19 is a lower respiratory tract infection, which means that you'll feel it in your chest and lungs, which is different from an upper respiratory tract infection that causes runny nose and sinus congestion.
If there's symptoms that are beyond just the eyes and nose, then that gives you cause for concern about flu or coronavirus. And so typical things are temperature, like a fever or a headache. Also muscle aches are something that's very common. Any general sense of malaise or being tired is something that you'd also see with a virus that you wouldn't necessarily see with allergies.
Hopefully, you just have allergies. And if so, there are a few things you can do.
Trying to avoid going outdoors or wearing a mask when going outdoors. There's also pharmacotherapy, so medications, nasal steroid sprays, such as fluticasone, or antihistamines that are over the counter can also be effective.
And remember, no matter what, keep washing your hands and try your best not to touch your nose, mouth, or eyes to help stop the spread of coronavirus. In Columbia, Samantha McCullum, Watch Fox News.